Hey everyone! So I just wanted to make a quick little introduction on behalf of me and everyone in my group to say that we tried to make a video all together and then got ready to submit the whole thing and then realized we didn't have any audio. So this is what we're working with, and I hope this reaches you well and is well informative, and we're going to be talking about CTE.
Hi, I'm Lillian, and I'm just going to be talking about basically what CTE is and how it was first discovered. So the basic definition of CTE is a progressive neurodegenerative disease caused by repetitive head injuries such as concussions and subconcussive hits. The history of CTE is that it was kind of first discovered in 1928 when Dr. Harrison Martland said that a group of boxers had punch-drunk syndrome, is what they called it, and it was later found to obviously be CTE due to obviously boxing the repetitive hits to their heads. Just obviously at that time there weren't really autopsies done on the boxers to be able to find CTE, and they didn't really know that that could be a possibility to be looking for. And then the first time CTE was discovered in football was in 2005 when pathologist Dr. Bennett Amalu published the first evidence of CTE in an American football player, which was former Pittsburgh Steelers player Mike Webster. And so more on the first diagnosis of CTE in football, again, it was Dr. Bennett Amalu, who was a neuropathologist who was working as a forensic pathologist, did an autopsy on Mike Webster, and he found a bunch of super interesting things in his brain, which I'll get more into later. But if you've seen the movie Concussion, it's a lot about this. It's super good to watch, but you would know that this was really, a lot of people were really against Dr. Amalu doing this, and they thought it wasn't a good idea, but obviously it was good in the end. The key findings in Mike Webster's brain that allowed his CTE diagnosis was an accumulation of tau protein. So Amalu observed massive deposits of a toxic protein called tau, which causes brain cells to mishap and die. And then there's also brain scarring. So in Webster's brain, there's a lot of brain scarring, which had shrunken and damaged his brain cells. There was also a degenerative pattern. The pattern of his tau was abnormal and random, which was unlike any other known dementia, suggesting a new disease because they thought Mike Webster had dementia, but after looking into his brain, they knew that's not what it was. And then there was also signs of premature aging. So basically, Webster's brain just looked a lot older in age than it should have been, which all of this led to his CTE diagnosis.
So I'm just going to be talking about some of the most famous cases when it comes to CTE, starting with someone who actually went to UTK, Richard Pickens. He was a fullback, and he experienced all the commonly associated symptoms when it comes to CTE, such as motor loss, cognitive loss, memory loss, and just behavioral changes. The one in the middle is Frank Wycheck. He was a tight end for the Titans, and once again, all similar symptoms, once again diagnosed with CTE post-mortem. And then the most famous, arguably, is Aaron Hernandez. He's most known for his triple conviction of murder and ultimately his suicide. And he, once again, had all of the similar pre-mortem symptoms and was diagnosed post-mortem. So they know that all of that and ultimately all the terrible things that happened were because of his CTE. And the fact that all of these are so similar, but they were all in such different situations, shows that there is some underlying factor and that there does need to be some awareness of just the similarities between all of these cases and how hopefully something can be done in the future.
I'm going to be talking about some of the causes and risk factors of CTE. So the main cause is repeated head trauma, also known as TBI or traumatic brain injury. This can often result in the diagnosis of concussions, but an official diagnosis of having a concussion is not necessary to later develop CTE, but it's very common. And then lastly, the medical or cognitive true reason for developing CTE is the buildup of tau proteins in the brain. And then for risk factors, the greatest risk factor is being an athlete, as professional level athletes and college level athletes are at a much higher risk of incurring TBIs and then later developing CTE. And then additionally, the instance of neuroinflammation after having head trauma is linked to later developing CTE. And then the formal definition for the most common risk factor for CTE is closed head impact injuries, which are most commonly linked to later being diagnosed with CTE within the high-risk population of athletes.
Hi, I'm going to be talking about the symptoms of CTE. There are four main groups of symptoms: cognitive, behavioral, mood, and movement. Cognitive consists of trouble thinking, memory loss, which is a big symptom of CTE, and organization issues, which could include completing simple tasks or day-to-day activities. Behavioral changes often result in aggressive behavior. People tend to become more aggressive due to CTE. Some mood changes include depression, more depressive thoughts, and often this results in substance misuse. Some movement symptoms include walking and balance issues, shaking, and a loss of control of their body. There are 4 stages of CTE. The first stage is memory loss, headaches, and aggression. These are all mild symptoms in stage 1. Stage 2, depressive symptoms and thoughts of depression often begin, as well as mood swings where small things become a big deal, a much bigger deal. The third stage results in aggression, changes in mood once again, and dysfunction, issues with balance. These symptoms are severe yet more mild than stage 4. Stage 4 has a lot of the same symptoms as stage 3, however, they are more severe. There are also symptoms of paranoia and dementia that begin in the 4th stage, as well as issues with concentration and living their daily life.
Hi, I'm going to be talking about whether there's cures and then possible treatments for CTE. Currently, there are no known cures for CTE, even though there's been lots of research and studies on it. It's really hard to find a cure when the possible people who diagnosed aren't even officially diagnosed until death, until their brain can be studied. So there's not a lot of information to use while they're still living to find the cure for that. But a possible treatment in progress is HBOT, aka hyperbaric oxygen therapy. Basically, it is you put someone in a hyperbaric chamber and it saturates their plasma with oxygen, and it basically has healing powers, which is really awesome. It's used a lot for DCS, aka the bends, and that's like when nitrogen gets in the blood with like diving and stuff. So it's an extremely helpful and non-risky treatment. It's just not very well known because there's not any patents for it, so lots of healthcares and like companies can't make any money off of it, which makes it less of a priority, which has also sparked a lot of controversy. But yes, this is a working one because and the same types of trauma that people with CTE have is the types of trauma that people with the bends develop, and that's what HBOT cures. So
hi, I'm Sophia, and I'm going to be talking about the prevention techniques for CTE. Because as briefly discussed, there's no cure for CTE, no like established treatments, and it can't be diagnosed before death. The main focus is prevention. So I split it into 3 different categories here. We have sports and activity modifications, protection equipment and safety protocols, and then health and medical monitoring. So with this first category of sports and activity modifications, the general gist of it is just limiting repetitive head impacts. So especially in contact sports, trying to keep those to a minimum will greatly decrease the risk for CTE. Something that helps with that is enforcing rule changes in contact sports. An example of this is in the NFL, they have banned helmet-to-helmet contact and head-first tackling, so that obviously reduces the direct head impacts. And then another thing is just reducing the number of full contact practices. This is already like a pretty common thing, even in high school, like football. Just not every day of the week is going to be a full, all pads, all helmet, full contact practice, and that is again to just reduce the number of those severe head impacts. In our next category, we have protection equipment and safety protocols. So the first thing is just having proper fitting equipment, such as mouth guards and helmets. When they are fit properly to each individual, they are better able to do their job in protecting that person, their skull, their brain, all of that. Next is using advanced helmet technology, such as in the NFL, a lot of players, at least during practice, will wear the extra like padding around their helmet, and that again just adds another level of like safety from that equipment to reduce the severity of any head impacts that they would have. Then lastly is concussion protocols, making sure that they have proper protocols in place, and then also having the proper medical staff on like standby. And so specifically, I know the NFL, if it's like believed like they had a severe head injury, such as a concussion during a play, they are immediately taken off the field to get what's the word? Evaluated. Take them into that blue tent that most people know, and then if it's like determined in there that they at least need like further evaluation or that they have a concussion, they go back, they don't go back in the game, and then they have a 5-step protocol for them to like reestablish gameplay and like slowly ease back into it before they're allowed like back into games. So then in our last category for medical and health monitoring, one major thing is having baseline cognitive testing that they can like track changes throughout like years, months, whatever, or even just like before versus after an injury. I know this is like starting to take place in like lower level sports and even like non-contact sports, because I played field hockey in high school, and I know we always had to do it in the beginning of seasons, and then if anybody got a concussion, they would retest you before they like let you play again to see if like the changes are like too severe or anything like that. And then also having return to play guidelines that put health over competition. So like I know there's been concern with some like NFL players coming back like too soon, or coming back just like in general, just like when they should like probably stop because if they had too many concussions. An example of this would be Tua Tagovailoa. Don't know if I said that correctly, but he's had multiple severe concussions to the point of like seizing on the field or just like freezing completely. and he always just like comes back after them. He clears protocol, but it like you can tell sometimes in like interviews and stuff that like his brain's kind of lagging, slight like cognitive decline probably. So that could be like a lookout in the future whether he has develops CTE. And then also lastly, just early symptom reporting, like just really like pushing for that. Like if you have concussion and they're like, okay, well, like you're clear to go back, if you realize you're still having headaches, if you're getting memory loss, mood changes, just like tell somebody and get further evaluation, because maybe something else is wrong and they can try to do other treatments to then prevent any severe medical issues. And so yeah, basically all of this will help decrease the risk of getting CTE.